Hi students. So in this class we are going to talk about indirect retainers in RPD, and I am Dr. Jagdish here to present to you this chapter. So before we go on to the indirect retainers, we have to know about the types of movements in a RPD. A partial denture can have two types of movements. One is a vertical movement or a rotational movement about the axis. The vertical movement can be either towards the tissue or away from the tissue. To make this easy for you to understand, just imagine a seesaw with a force. So the force can be downward like this, which is a movement which simulates the towards the tissue, or a movement like this upward, which is a movement away from the tissue. So the movement which is towards the tissue, to counteract this movement, we have a hook on the opposite side. So if we hook this on the opposite side, this is a direct retainer which is taken care of by the clasp assembly in a partial denture. But to counteract the movement in the opposite direction, that is a movement away from the tissues, if we have a vertical stop in this area, like we put a stop there on the other side of the seesaw, and this type of movement is counteracted by the indirect retainer. So to be very specific, the combination of direct retainer and indirect retainer will prevent this rotational type of movement in both upward and the downward directions. So this is the diagram of a partial denture. So imagine that there is a sticky food, or a patient is having something very sticky like a chewing gum, and the denture base is lifting away in the posterior. So if we don't have any stop in the anterior portion, the denture base will slip off, or it will tend to go and impinge on the tissues in the anterior. So to prevent this, we have an indirect retainer in the anterior, which is this blue color rest, which is placed on the anterior to support the, or to prevent the rotational movement. So thus the main function of the indirect retainer is to prevent rotational displacement of the denture towards the tissue, and this type of rotation usually occurs around the rests. So this rotational axis, or the line around which the partial denture tends to rotate, is called as the fulcrum line, or it is an imaginary line around which the partial denture rotates. So the fulcrum line axis passes through the most posterior abutment, and it is only imaginary. So we have different types of fulcrum line. You can see that for class 1, the fulcrum line runs to the two abutments. It can be either straight like this, or it can be a diagonal fulcrum line. For class 2, we have the fulcrum line like this. Again, it can be diagonal or straight. For class 3, we'll come back to that later. First, we'll see class 4. The fulcrum line is more anterior because the edentulous space is in the anterior direction. Class 3 usually does not have a definite fulcrum line because it is supported by teeth on one side. So the primary abutments, since it is supported by the primary abutments on one side, there is no rotational movement, and so usually class 3 does not require a indirect retention. So what are the requirements of an indirect retainer? The indirect retainer should be 90° away from the primary fulcrum line, which is, it should be as far as possible from the fulcrum line. It should be placed from the far from the distal extension base as possible, on a tooth which is capable of supporting its function. It is usually placed on a tooth which something like a canine or the premolar. So the slope of the canine, that is the cingulum of the canine, should be able to support this indirect retainer so that it does not slip away or slip down. So it can have two or more rests with supporting minor connectors. So this is how we plan the indirect retainer. We have two primary abutments. So if we draw a fulcrum line from the primary abutments and draw a bisecting line, that is a perpendicular line in the middle, it is pointing towards the premolar. So the premolar will be the location of this indirect retainer in this type of situation. So what are the factors which influence the effectiveness of an indirect retainer? The primary occlusal rest must be firmly held with the help of the direct retainer. So if the rests itself are not stable, if the rest itself are moving, then in that case, the indirect retention becomes weak or it is non-functional. The second is the distance from the fulcrum line. The longer the denture extension phase, the longer will be or the more of indirect retention, because the long distal extension base can easily lift off from the tissue, and so you require more amount of indirect retention. The location of the fulcrum line, as we have already seen, it can vary between the different types of classes, and how far the fulcrum line or the distance between the indirect retainer and the fulcrum line should be long enough. Then the rigidity of the connector, that is, indirect retainer should be supported by rigid minor connectors so that it functions effectively. If the minor connectors are not rigid, the indirect retention becomes ineffective. The effectiveness of the supporting tooth, as I told you, we should have a firm canine with a proper cingulum or a premolar which are capable of supporting. For example, if the tooth inclines, that is, your canine does not have a good cingulum, in that case you cannot place a occlusal rest or an incisal rest on this tooth, because it is not going to prevent the slippage of this indirect retainer. So we'll go and see the indirect retention for different classes of RPD first. So this is the position, the two red dots show the fulcrum lines or the primary abutments. And so if we draw two lines perpendicular to this, we end up in having the canines as the position for the indirect retainer for the class 1. So this is the example. It's a clinical case where you can see the indirect retainers placed on the canines. So this is the clinical photo. In class 2, similarly, you draw a line perpendicular to the fulcrum lines, and here you have the indirect retainer either in the canine or the first premolar. This is the clinical photograph. So similarly, as I told you, class 3 does not require indirect retention because there is not much of rotation movement because of the tooth support. In class 4, the fulcrum line is more anterior, so the indirect retainers are pushed to the posterior abutment teeth. So what are the other forms of indirect retainer apart from your cingulum or incisal rest or additional rest? One, the major connectors, that is the lingual plate in the mandible, can act as an indirect retainer, but it can act as an indirect retainer only when it is supported by a occlusal rest either on the premolar or on the canine. So this is very important. The next is the cingulum bar, which can also rest on the cingulum of the anterior teeth, and so this can act as a indirect retainer. Most commonly, this type of indirect retention is used in distal extension partial dentures or long span distal extension partial dentures like your class 1 or class 2. Sometimes the modification areas, that is the areas which are there apart from the primary classification, are called modification areas. So if the modification areas are in the anterior, and these modification areas are supported by good rigid tissue or well keratinized tissue, which are not flabby or the tissues are not moving, so in that case, the firm support provided by the tissue itself can act as an indirect retainer, which prevents the downward movement of the partial denture. The rugae support, especially in the major connector which covers the palate, so if this major connector is covering the rugae also can provide some amount of indirect retention. So this completes this chapter. So to sum it up, if we are going to talk about indirect retention, then we have to talk about what is indirect retention, what type of movement or rotational movement this is going to counteract, and what is the difference between a direct retainer and an indirect retainer, and what are the forms of indirect retainer or different classes of your partial dentures. This is ranging from class 1 to class 4. And then you have to write about the other forms of partial indirect retention, that is your rugae, your major connectors, and your modification areas. So thank you.